All right. Well, a big good morning to everyone. Thank you all for joining, parents and caregivers and whoever else has decided to sign up and join as part of this webinar this morning. This is the Courage of Carly Fund's first webinar. I'm Rebecca Vogt. I'm the Media Relations Specialist at Roswell Park Comprehensive Cancer Center here in Buffalo, New York. We do understand how certain and uncertain and scary life can be when dealing with a pandemic during a child's cancer journey. So this chat this morning, our team of medical professionals, they're all here to answer any questions regarding COVID-19 and all the steps that Roswell Park is taking to limit risk to pediatric patients with cancer and blood disorders. We are also going to discuss some of the strategies for managing disruptions to school services and trips for families to stay busy during this extended isolation period. I am joined by some of your favorite people in the pediatrics department at Roswell Park, and that includes the likes of Dr. Cara Kelly, Dr. Kate Flanagan, we have Dr. Stephen Ambrusco, Dr. Beverly Schaefer, Dr. Denise Rokitka, Dr. Barbara Bombach, and child life specialist Jessica Wadium. Now we're going to go around, do a quick little round table and give a brief description of each of your roles at Roswell Park. So Dr. Kelly, I will open it up and start with you.
Okay, hello everyone, and thanks so much for joining us this morning. I'm Dr. Cara Kelly, and I'm Chief of the Roswell Park Oshai Children's Cancer and Blood Disorders Program. So I'll turn it over next to Dr. Bombach.
Good morning, everybody. I'm Dr. Barbara Bombach. I am one of the attending physicians here at the Roswell Park and Children's Hospital, Oshai Children's Hospital, Pediatric Hematology Oncology Program. I am also the clinical director of the Pediatric Blood and Marrow Transplant Program. Next.
Why don't we go over to Dr. Flanagan.
Hi, my name is Dr. Keith Flanagan. I am one of the pediatric psychologists with our Pediatric Hematology Oncology Program at Roswell Park and Oshai Children's Hospital, and glad to be with you this morning.
Fantastic. We'll pass the mic over to Dr. Ambrusco.
Hi, good morning, everybody. I'm Dr. Ambrusco, and I'm one of the hematology oncology attendings again at Roswell and Oshai. I'm the director for our Sickle-Cell and Hemoglobinopathy Center, so taking care of all the patients with sickle cell disease and thalassemia, as well as one of our members of our non-malignant hematology team with Dr. Schaefer.
All right, that being said, Dr. Schaefer.
Good morning. So I'm Dr. Schaefer. I'm a pediatric hematologist, and I specialize in the care of children with blood disorders.
Great. I will shift on over to Dr. Rokitka.
Good morning. I'm Dr. Rokitka. I'm also a hematology oncology attending here within our program, but I also am the clinical director of the Pediatric Cancer Survivorship Program as well. And I don't know who's left. Jessica?
Jessica, yeah, you're right. Jessica's left. Yeah, Jessica, last but not least.
I'm Jessica Wadium. I am the child life specialist for pediatrics at Roswell Park, which means that I help children cope and understand their diagnosis and treatment.
Fantastic. Well, a big welcome to all of you. And again, a welcome to all of our participants who are joining in. Now, we are going to start by answering some questions that have been pre-submitted. However, if any of you think of a question during the discussion, feel free to drop it in the chat down below. There should be a little chat bubble there, and you can send it off to all of our panelists. We're going to be keeping an eye on it, monitoring it, and hopefully we can get to some of those questions too. But a reminder that it's not the Q&A bubble, it is the chat bubble. So that all being said, we can kind of jump right into it. So one of the first questions we have sort of coming in is, how do I protect my child from COVID-19? Does this look any different from a child who does not have a cancer diagnosis?
Okay, I can start with the first one. I think that one of the things is that all of you, caring for a child with cancer or with a serious blood disorder, practice social distancing as a baseline. You're all very, conscious of avoiding people that are sick, staying at home, not going out much, especially in crowded areas. And so, as a result, that has really helped to spread the, to reduce the impact and the risk of getting COVID. What we're seeing and what our colleagues in some of the big centers like New York City is that the relatively few children with cancer are developing coronavirus. So I think, doing what you do already is really important. In addition, we are recommending a few extra things, like making sure that both you and your child wears a mask, especially if your child is 2 and over. Washing your hands even more. But I think, what we're seeing is a lot of the usual things that you do is very effective in helping to prevent your child from getting this. I don't know if my colleagues want to add anything else to that.
seeing now, I'll do a shift here. How does COVID impact some of our BMT patients? Anyone want to take that one on?
Sure, I can do that. Certainly the bone marrow transplant patients would be considered to be immunocompromised, like many of our other cancer patients that we treat as well. And, we do worry about whether or not COVID-19 can impact those patients that are more immunocompromised. So absolutely following all of the recommendations that have been put out there in terms of social distancing, hand washing, masking, avoiding large crowds, all those things that Dr. Kelly just spoke about are extremely important. That said, even though the risk is there because they're immunocompromised, in the pediatric world, what we are seeing is that children in general don't seem to be as severely affected as many adults are. And there have actually not been any reports of pediatric bone marrow transplant patients that have had problems with being very sick with COVID-19.
We talk about the younger population, but I mean, we have to also kind of consider the survivor end of it too. And are survivors at more risk for COVID-19 than, say, that their healthier peers? Dr.
Yep, got it. So I've gotten that question actually a lot from a bunch of patients that have called us. Really, we think that the immune system should be generally back to normal at least 6 months to a year post chemotherapy or post any sort of cancer treatment. So the survivors in general shouldn't be at a higher risk or a higher risk category. That being said, some of our survivors have had treatments that it can affect lungs or heart. And so people should, again, continue to practice social distancing and just be very careful. And if they have specific questions, they're welcome to call us as well.
Okay. Given that everything has really been, shaken up with all of this, is there anything that can be said about any changes with pediatric treatment plans? I don't know who would like to take that on, but are there any changes with a child's treatment plan right now?
I think it's most importantly, we don't want to lose sight of the fact that it's so important that we continue to treat their cancer and that we don't make any modifications that are going to take away from, many of the high success rates that we see today with our cancer treatments. So we are, not modifying therapy, and this is, true across the country. Like, again, as I mentioned before, even in the hot zones like New York City and in some places in Europe, places are still moving forward and making sure that chemotherapy is delivered. It is, though, important that we do have a contingency plan. I think, although it's very encouraging that we're flattening the curve and that we're not overwhelming our healthcare systems, a lot of us have been very busy in making sure that we have contingency plans, plans that we never hope to have to call on, but, looking at what alternatives we have to make sure that we still maintain a high cure rate, but also deliver treatment in a safe manner. So in fact, there was an international effort of pediatric oncologists from around the entire world that got together and put together suggested treatment modifications if chemotherapy drugs or blood transfusions or other services weren't available. So at least now we have a roadmap, to follow, and this is with the input of all of the experts in this, all these different diseases that we treat. So, so there's been a lot of work to prepare, for worst case scenario, although fortunately we haven't had to do any of that to date.
Okay.
That being said, I will mention we have deferred some kind of more non-emergent things, like some of our patients, have, some of you may be having CT scans or MRI scans. just to keep an eye on things, so that we're not bringing you into the health center. We have deferred some of those tests for some period of time, but I think especially since we're not seeing a lot of activity of the coronavirus, we are beginning to reschedule some of those tests because it's important we still have that information for helping to make sure that your child is kept on track with their treatment plan.
Oh, go ahead.
Sorry, if I could just as well. In terms of the bone marrow transplant patient population, the one thing that has been deferred in terms of that is, again, transplants that are considered not to be critical at this point in time. That doesn't mean that the child doesn't need a transplant at some point, but for patients that have some of the non-malignant diseases, such as perhaps a sickle cell patient or a patient with thalassemia, those transplants can actually safely be deferred at this point in time until hopefully things are better and safer from the COVID perspective. So some of our transplants, we are putting on hold temporarily, but certainly patients with malignant diseases where the curative need is critical from a timing perspective, those are still moving forward. And as a safeguard mechanism for those patients, we are actually testing those patients before they undergo their transplant for the COVID-19. And both of those steps, the testing of the patients if they are going to undergo transplant and the deferral of certain populations of patients for transplant, are recommendations that have been put out by some of the national societies, such as the American Society for Transplant and Cellular Therapy, and the Center for International Bone Marrow Transplant Registry. So we are following those guidelines.
Just to piggyback off of that, thank you so much. There was a recent Cancer Talk blog on our website that detailed a little bit more about our approach to surgeries right now. So that is something, if everyone wants to go check out our Cancer Talk blog, there's a little bit more information on there as well. But, we talk about treatments. Shifting over, what about transfusions right now? Is COVID-19 impacting our pediatric patients' transfusion schedule? Is there a shortage of blood? What are we kind of handling?
I can take that question. So we do have obviously a number of patients who are on chronic transfusion therapy, as well as our oncology patients who are needing transfusions when needed because of their treatment. Thus far, it has not impacted the blood supply in Western New York, which has been a good thing. I think a lot of things that we're seeing, not just in Buffalo and Western New York, but across the country, is because we are rescheduling elective surgeries when they would be needing transfusions. We kind of have a fairly stable blood supply, even though there are maybe fewer donors because of donor drives and whatnot. We're not seeing maybe as many of those, but we still have a decent blood supply because we're not doing as many of those other surgeries. So thus far, it has not actually affected our blood supply. Any of our patients with thalassemia or other blood cell disorders, including sickle cell disease, have not been affected. That being said, if there were to be a blood shortage, we do have kind of a plan in place for how we would address that with some of our patients. Obviously, patients who are in dire need, they will be able to get blood, but maybe there's some patients where we can make some adjustments to their therapy to allow them to still be getting treatment, but maybe not necessarily using up as much blood.
Similarly, obviously this is something that, there's, transfusions happening at Roswell versus being at home with your child. What's being done? What happens if a child's medication is running low?
So certainly we have the ability to call in medications, send them in from our computers. So that should still be the same. Thankfully, we do have a number of our patients, especially our oncology patients, but even our hematology patients, where medications are being delivered. So certainly not even needing to go to the pharmacy. That option is open to other families who may not get that, that if they wanted to choose to do that from a different pharmacy, we do work with a number of different pharmacies who do provide that. So not necessarily needing to come in and get medications, but certainly just call if you need anything as far as refills and whatnot.
I'll just add to that quickly that One of the things that's also happened recently has been a little bit of relaxing of the interval of when you can call in a prescription. So traditionally, some insurance plans have said you need to call every 30 days. We're only going to give you 30 days at a time. But there's been a little bit of relaxing on that so that patients can fill their prescriptions earlier, for example, if it's more convenient for them to make one trip to the pharmacy instead of two. So there is a little bit more wiggle room in that regard than there has been in the past.
Thank you for that, Dr. Schaefer. Now, say a child may need to go to the ER, something's happening, something's flaring up, what have you. Given the increased risk of exposure, how should a parent or caregiver know when to take their child to the ER for a pain crisis?
So in regards to that, what we always say pre-COVID is you should call first, okay? A lot of people are scared now, and what they're doing is they're just staying home because of that fear of coming in. But at the same time, there may be times that you really, truly do need to be seen. And yes, there might be COVID around, but thankfully, as has been alluded to by many of the physicians here, we're not seeing as much of it in pediatrics. So it's not like you're going to come to Oshai emergency room and every other patient has COVID. That's not the case. So the chances are relatively low that you would be exposed just simply by coming to the hospital. So that being said, if you are having an issue, if you're one of our oncology patients who has a fever, you should be calling us and you should be coming in. Sickle-cell disease, as is always the case, if you have a fever, you need to be seen. You could have a blood infection. That has not changed. And if anything, I actually worry a little bit more that if you have a fever because of COVID, you might need to be evaluated just simply because of that. Since you mentioned pain crisis, obviously that could be the case too, that if you really think that you need to be seen, please call us first, okay? There might be some things for a pain crisis you can manage at home. If you don't have a fever, you might not have to be seen. And there are sometimes things that you may have already done, things that you may not have done, but call us first before you just come in. There might be times that you have literally tried everything at home and you do have to be seen. One of the things that we are seeing in the sickle cell community nationwide and internationally is that pain might actually be one of the first symptoms of coronavirus, a pain crisis or a pain flare. That does not mean you necessarily have to be seen, but it should mean that you should call if you are having concerns, especially if this is out of the ordinary. Maybe just taking an ibuprofen is not cutting it at home, or taking whatever pain medicine you're getting at home. So you might need to actually be seen, but either way, call first. We don't really want patients to just show up to the emergency room. The other reason why is because that way, if you call us first, so if I'm on call and you say, I have fever, I have pain, and you call me first, I will call the emergency room, or any of my colleagues on call will call the emergency room and tell them the plan. It actually can facilitate things a lot better. And that goes for more than just our sickle cell patients. That really goes for all of our patients.
Thank you for that. You talk a little bit about the pain side effect. Are there any sort of best practices for evaluating a child's, say, sickle cell chest pain versus COVID-19 symptoms?
In some ways, we may not know the difference between the two. And in some ways, it might actually be both. So it is important for chest pain in particular. Now, some of our sickle cell patients might have chest pain as one of their common places where they have more chronic pain. That might be a little different, but it doesn't necessarily mean you shouldn't call. But chest pain in a sickle cell patient, especially if it's nothing that you've had before, could be an acute chest syndrome, or what some people call a chest crisis. That isn't a medical emergency, and you do need to be seen for that. Even still, I go back to what I said before, you should call first, okay? But chances are, if you have chest pain like you've never had before, especially if it goes along with a fever or shortness of breath or a bad cough, you likely need to be seen, okay? It could be coronavirus, it may not be. That is something that you won't be able to evaluate at home. You need a chest x-ray, you need to be evaluated, you need a blood culture. Those are things that we cannot do at home and we cannot imagine at home. So again, you need to call because you likely do need to be seen.
And while we hope that, no young patient, no child gets to that point, we kind of have to look at sort of the, keeping kids healthy at this point. So are there any sort of tips that anyone can pass along right now if a child has sickle cell disease, keeping them as healthy as possible right now and out of the hospital?
So as Dr. Kelly mentioned before, and as all of us have really been mentioning, social distancing at this point cannot be underestimated. It is extremely important. So limiting yourself from even getting a fever because of a cold or something else. We're actually seeing that. We're seeing a lot fewer patients coming in with fever unrelated to COVID. So just that social distancing is extremely important so that you're not around other people that could have coronavirus or other infections. Staying well hydrated, moving around, and it does mean you can still go for a walk outside, but with social distancing in place. Wearing a mask if you're outdoors, not associating with people that are not in your household is extremely important. If you do start to have pain symptoms, certainly treating them at home, although chest pain is a little bit different. But really that social distancing is extremely important, and good hand washing. While everyone ran out and got Purell is great, soap and water is even better.
Absolutely. And whatever you can sing or chant or whatever for 20 seconds, right? I mean, I'm sure everyone's been practicing that nonstop. That kind of leads us into our next sort of phase of questions, and that's sort of, how it relates to the hospital and keeping patients safe. So what precautions are in place for our pediatric patients when they come through the doors of Roswell Park?
Just maybe, Denise, do you want to answer this one?
Sure. So at Roswell Park right now, when you come in through the doors, everyone is getting temperature screened, as well as questions being asked, do you have any symptoms of COVID? Everyone is masked at the door before they come into the institute. We've also decreased the overall volume within both institutes is definitely down, and on purpose, so that there's less people, able to infect others. And the same is true for Oshai. Everyone is getting masked, getting a series of questions asked, and getting their temperature checked as well. And there's also, in terms of entrances to both hospitals, have been very limited, so that there's no possibility that people haven't been pre-screened before they're in the hospital.
I just want to say that, we also have done a lot to reduce the number of staff and employees coming onto the medical campus. At Roswell Park, there's a lot of people that do primarily research. Most of them are all working from home now, just again to limit the number of people coming, on. Even within our own group, our physicians are on, at the hospital on the days that they're seeing patients, but then working at home on, and still answering questions, still on their computers. But again, we're just trying to reduce the number of people that are coming through as a means of further limiting the spread.
And if I could also just add in, unfortunately, in terms of trying to limit the number of people that come in, that also includes limiting the number of visitors that come in with the patients as well. We know that can be difficult for the patients and their families, but we do feel as though it is critical to really keep things down to a minimum. So on the outpatient side, we have the pediatric patients allowed to come with one parent instead of both parents or families. And on the inpatient side, 2 parents or caregivers are allowed to be people that come and go, but one at a time with them switching on and off. So that is something that we've also had to do as well. On the outpatient side, when patients do come into our clinic, we're really doing everything that we can so that they're not sitting in the waiting room for a prolonged period of time. We're getting them checked in and quickly back into a private room so that they're not exposed to other people.
Very fair. Yeah, go ahead.
I'll that too. One of the ways that we have significantly reduced our outpatient volumes as far as people being seen in person, waiting in the waiting room and whatnot, for one, is not having our playroom open. Obviously, you don't want people going in there and a whole bunch of people touching the same stuff. And in general, on a routine basis, it is cleaned extremely well. But obviously in this time, it's not really something that we can do. But we obviously have a very busy outpatient clinic, but what we've been able to do is do a lot of telemedicine. So seeing your doctor, similar to the way that you're seeing us all right now, where you are logging on to a computer program where you're able to do a virtual visit with somebody, or what people know as telemedicine. So in essence, by doing that for a good portion of our patients, that means that many fewer patients that are actually coming into our clinic, waiting in the waiting room, sitting in waiting in and patient rooms and whatnot, so that the patients who have to come into clinic, the patients who require a transfusion, the patients who require chemotherapy, where you can't clearly do that by a computer, so that they're protected from not having as many other patients around as well. And many of our patients have actually taken to that quite nicely. Many patients really like it, and even talk about potentially extending that beyond the coronavirus pandemic to some extent.
You make mention of the virtual visits that we have going on. Can anyone kind of talk us through what to expect with virtual visits?
So with the virtual visit, what we're having patients do is we're giving them instructions on how to be able to link with us, either via the patient portal or via other programs. And they're put on a schedule. They have a set appointment time. They log on to whatever program they're going to visit with us. And then once we see that the patient's there, it's their scheduled time, we log on as well, and we're able to have a chat just like we're doing right now. We're able to really take care of a good portion of things. Obviously, as hematologists, we do need to still look at blood often, and still look at lab results. But what I've done, even for a number of patients, I'm sure many of the other faculty have done, is to say, perhaps we can have you come in for a lab-only visit, come in quickly, get labs, leave, where you're not interacting with as many people. We can look at the results, but then talk by computer. So sometimes that has actually helped out for a lot of the visits too. And a lot of times pediatrician referrals to us, which we're still getting, we're still seeing new patients in that way. We're able to see the lab results that they were referred for and make decisions about what else is necessary at that time. Many of the patients have liked that. We've even had some new consult patients that we've done in that manner as well.
Is there, if someone was scheduled to have a physical appointment, is there a way to know whether or not it's going to be shifted over to a virtual visit instead? I don't know if anyone wants to take that on.
I guess.
So we.
Kara, go ahead.
Well, no, I was just going to say that our office will be contacting you to recommend whether a virtual, the physicians will recommend whether the visit should be a virtual one or not. And the office will call you, set up a time, we'll walk you through the process, as well as give you a reminder just prior to the appointment. Dr. Rokitka is kind of our resident expert with telemedicine. So if you want to add anything more to that or any other recommendations.
Not really. I mean, if there are concerns that you have that are specific, that you feel a virtual visit isn't appropriate, then certainly let the secretaries know and we can reach out to you ourselves. There are sometimes technical difficulties, or it's sometimes hard to do it, but we do have some other options. So don't give up. We are here to try and help and really want to continue to see our patients.
Fantastic. Thank you so much, Dr. Rokitka, for wrapping that side of it up. One of the hot words we keep hearing about, it keeps floating around, testing. So that all being said, can pediatric patients get tested at Roswell? Are there any requirements to be able to receive such testing?
Okay, I guess. So yes, everyone can get a test. So we are currently testing any patients with symptoms. And those can be done either in the clinic at at the clinic at Roswell, or in the emergency department at Oshai. And as Dr. Ambrosco said, just call us and we'll determine what's the most appropriate place for you to be tested, depending on what's going on. Things are getting better, with the tests, and that they are more available than they were just a couple of weeks ago. And we are getting results faster, but there still, unfortunately, is a bit of a lag time. We're hoping at some point to be able to have a test where we can get a result back in a matter of hours. Now it's still taking about 1 to 2 days, although our patient populations are prioritized. So they are getting fast-tracked compared to some of the tests that are being done in the community. But importantly, call us with any symptoms and we'll determine what's the best place to do it. In addition, as Dr. Bambeck mentioned, there are certain circumstances where we're also doing testing in bone marrow transplant patients, as well as patients that are having any surgery or need to have any radiology tests under anesthesia. And those are being, the surgery and the imaging ones are being done through OSHI. We have a drive-up testing facility, so you'll be called with instructions on where to go and what time to go, and that way you could just go to the drive-up place, have the swab done, and then we get the results back before the procedures are done.
So then what happens if someone in the household begins to show symptoms? Where does a family go from there?
I just put it out. Maybe Bev, if you want to talk about this.
Sure. So I think that in terms of household context, you're welcome to call us as well and talk to us about what the family member is experiencing. Obviously, there's a limit of what we can recommend as medical management for somebody who's not our patient. So in some cases, we'll really help you and your family decide what are the next best steps, whether this family member needs to be evaluated by a healthcare professional that knows them well, like their primary care physician. If they don't have a primary care physician, then what would those backup plans look like? And whether that's an evaluation by a teledoc through your health insurance, perhaps, or through your healthcare institution or your healthcare partners, or if that's an evaluation in an urgent care or an ER. So basically call us and we will help you develop a plan for your family member as well.
Regarding your child, however, if they've been exposed to a family member that has COVID-19, it's really monitoring. It's monitoring for the disease by symptoms in terms of fever and cough and shortness of breath, and temperature taking as well is what's recommended 1 or 2 times a day. And if you're seeing any changes in any of that, certainly calling us, if your child may be showing some of those signs or symptoms. Obviously, anybody that who is positive for COVID-19, any precautions that you can take to keep your children away from that person, the better, but not to the point where we would tell you to move out of the house.
And just to add to that, if it's possible, for the sick person to stay in their own room and to not have your child interacting with your family member, if you have more than one bathroom in your home, try to have one reserved for that person. And so I think as much as you can try to kind of isolate, the sick person from your child, that's helpful, but we recognize that that's not always feasible. You may not have a living situation that would allow that to happen.
Great, thank you, Dr. Kelly. We've talked a lot about, we mentioned a bunch of outpatient stuff. Is anyone able to kind of delve into, what sort of policies are in place for inpatient?
Sure, I can speak to that. So right now at OSHI Children's, what we have is we have our hematology oncology floor where we typically have our patients. But if we have any patients who are suspected of having coronavirus, possibility of having it, we are doing testing to rule it out, or who have actually had coronavirus, which we have had coronavirus patients. They're being put right now on a separate floor, so they are away from the rest of our patients. So not only just so that we can provide coordinated care for the patients who do have coronavirus or may have coronavirus, but making sure that our patients where that's not really suspected are also kept separate, and so that both populations are able to get appropriate care. So right now we have the 10th floor of the hospital is kind of the designated floor where potential or confirmed cases can still get adequate care. From who's caring for them standpoint, we do have a separate house staff team. So that's when we talk about residents that are taking care of patients, so that we don't have residents who are bouncing back and forth between an infected person and somebody who's undergoing a bone marrow transplant. We ourselves all have PPE so that if we are taking care of a patient, we can still be protected. Regardless of where they are, we are still the doctors managing them. So it's not like they're going on to a different service and who knows whether or not they're getting appropriate care. You still, if you do have coronavirus or suspected, are still getting cared for by a hematology oncology doctor, and making sure we're giving them the most appropriate care as well.
Thank you so much for that, Dr. Ambrosco. One of the other big things is to think about is, of course, sort of the mental health aspect of all of this. I'm sure it could be a very stressful time, not only wondering, am I bringing my child, to the center? Am I not? Am I keeping them home? All of these things kind of really add up. So we'll kind of shift into that mode. How do parents or caregivers explain to their kid, both the patient and the siblings, why during this time we have to be even more careful, sort of without making, the child who is the patient feel guilty about the whole situation?
Absolutely. That's a really hard position to be in, as children can often feel guilty that they're adding stress to their families' lives. So what we suggest is that you talk as a whole family. So you gather your children and you have an open and honest conversation about how, as a family, it's important that we try to keep everyone safe. And it's our jobs to protect each other and ourselves. So you take less off of the patient and really make it about everyone and everyone being a team. And then you empower them to figure out solutions to how they can keep themselves and their families safe. So that's when you talk about hand washing, and maybe they bring up the fact that they've been asked to wear a mask outside. And you have those open and honest conversations, but really as a group focus. And then if you find that your child who is the patient is struggling with coping or more of these emotions, talking to them one-on-one. And also, we as a psychosocial team are always here. Sometimes children prefer to talk to someone who's not their parent, and that's typical and that's okay. And we're all available to help support them as well as the siblings, of course.
Now, one of the other bigger things, I know the entire team has thoroughly stressed the importance of the social distancing, the physical distancing, but I'm sure, there's a little hint of rebellion in some individuals, and I'm sure there are some folks that want to, go out and, play ball in the park, that sort of thing. So how does, a patient or a parent or a caregiver talk to a teenager or, someone who's a little bit older to understand the importance of that physical social distancing and emphasize it in a way that's not being overprotective or too hard on them?
I love that you just phrased it as a hint of rebellion. I feel like sometimes it's a little bit harder than a hint of rebellion. I think right now, a lot of what Jessica just mentioned is really critical. I think having some really open conversations as a family, but I think too with our teenagers, at some level, parents need to join with them in the frustration of the disruption that this has caused to their lives, and really work through the process of these are the ways that we can stay connected with people, whatever manner you can embrace that. I keep going back to our, human beings are social animals. Our social interactions and connections are critical. So any way that you can promote social interaction in a safe way, right? So using Zoom, using 9,000 different apps that are now available for kids to maintain contact with one another. They really, in terms of, I think the most important thing is really just joining with the child and having a very open and honest conversation about how this is incredibly difficult. It's awful. It's not normal. It is isolating, and really letting them know that they're validated in how they feel. I think sometimes parents tend to pop off to like, it's okay, it'll be fine, you're fine. And none of that's really helpful. It's really much more helpful to say, you're absolutely right. This is awful. It's icky. It's miserable. We'll get through it together as a family. We'll get through it together as a team, and really just joining with them.
And in general, I mean, how can, someone lower the stress level of their household? I mean, I'm sure everyone cooped up all together. Definitely there's some pent up energy, what have you. But yeah, I mean, how do we kind of, bring that down a couple of notches?
So, so this, I think, is where a lot of the things that we know to do every day just come into good practice. So as much as anything that looks like a routine can be established, routine is critical. I think anything that looks like we can still figure out how to get 8 hours of sleep, 10 hours of sleep for our little guys, maybe longer for our high school students, to make sure that they're getting adequate sleep, to make sure that, I mean, certainly the weather in Buffalo is not being as cooperative as we need it to be at some level, because it's helpful for the kids to be able to get outside, to move around. I know myself as a parent, I don't think I appreciated how much physical activity my kids are doing all day long, because they're running up and down the stairs and moving all the time in their classrooms. I think anything that parents can do to promote burning off some of that extra energy, and then for parents too, taking time that you need to regroup, whatever that looks like, however that is. If it's yoga, that's awesome. If you're playing cards with your friends on Zoom at midnight, that's fantastic. I think it's really about identifying what works for you, what works for your family, what works for your kids, and embracing all of those things, and not getting too caught up in the social media. Look at what awesome projects I did with my kids all day long, and look at the things that we created, and all of those things that kind of make this look picturesque, and in really just embracing that it can be really messy, and that that's okay. At least setting reasonable expectations for what we can do as families.
I'm going to add in there too, for decreasing children's stress, because children have all of the emotions as adults do, and they become stressed as well. So again, Kate spoke on routine. I emphasize that for the kids. You can take any sort of routine. I know all routine seems to just have been completely destroyed through this, and maybe you restart, and maybe tomorrow is a new day and you establish a new routine, and maybe it will take some time to have that be helpful. But once you get into a groove, that can help both the body and mind know what the expectations are. Also, to have a safe spot for your child to go to. So as you mentioned, you're all in a house together. You can be overwhelmed or annoyed with your siblings or parents. Have a spot for your children to go to, whether that's their bedroom or a different spot that they can just be alone, have quiet time, have a safe place. And then also to know that this is a hard time, and schools' expectations have been lowered. It's okay to feel like you're not okay. And it's also okay to really be creative during this time and turn it into a fun adventure. Maybe every Wednesday is Dress Up Wednesday, and you have new creative things to do with your children, to make it a fun time as well. And we all have a little bit of creativity in us, and if you pull that out, things like that is what your child's going to remember when they grow up.
Wonderfully said, for both Jess and Dr. Flanagan. So yeah, a couple quick takeaways from that. Safe space, big idea. Don't be a Pinterest hero. You don't have to go after everything that's on the internet, but also keeping that schedule too. That's very important. And I mean, even for adults too. I mean, all ages, really keeping a schedule is really big priority in order to keep sort of everything going on track. But again, it is okay to not be okay too, and that's also important to know. Here's a very interesting question. Now, how does one explain in a developmentally appropriate way to my child or their siblings, how their cancer is a different illness than COVID-19 and it's not something that's contagious?
Absolutely. So this is a really hard concept for a lot of children. And this is something that we usually talk about at diagnosis, because kids before their diagnosis are familiar with diseases that are contagious, like the cold. So what I suggest talking about with your child now is how their cancer or blood disorder, whatever you call it, maybe it's the boo-boo in their leg, whatever words you use at home, keep using those, and you can talk about how this is inside your body. Your blood, talk about your blood is sick, your blood's inside your body, and it can't go outside your body. It's strictly inside your body. However, the coronavirus is an illness that travels outside the body. So it can travel from one person to another person because it lives on germs outside the body, like when we cough or sneeze. And that's why we need to cover our coughs. That's why we need to wear a mask or hand wash and go back to that. With teaching about germs with children, I often use a glitter analogy. That children are very familiar with glitter. And once it gets on your hands and then you decide to touch something, now that has glitter on it too. And then you touch something else and everything has glitter on it. Same with germs. And so washing the glitter off of your hands, same as washing germs off of your hands. So that's a little tidbit for how to talk to your child about germs at a very appropriate level. But if your child is really struggling to understand their illness versus this really scary coronavirus, COVID-19 that everyone's talking about, feel free to reach out to us and we can help with specific wording for your specific scenario.
Now, we have to also look to the parents who are still working. I mean, many people are working from home, obviously. The directives that came from the governor, so many people are at home and adapting to that, but now there are people who are still going in who are considered essential. Now, if that is happening and you have an employer who may not be so understanding as to how important it is for said parent to stay safe from COVID-19, considering their child might be immunocompromised, is there any tips or best practices to help that employer understand that?
So I can say from personal experience, and Jess knows this, in our meetings, we've talked a lot about this. We actually have a few families who've had this experience, unfortunately, where they are in essential situations, so they have to physically be at work. And on top of that, they are feeling like their employer really isn't understanding their own level of anxiety, fear, concerns, particularly as it relates back to their child who's immunocompromised. So a couple of things that our team has always done, which I know is unique to our psychosocial team here, is really one, being a conduit of information for the parents. So we've done, and our social workers have done, an excellent and amazing job of looking at all of the changes that come in line with FMLA and paid family leave and unemployment benefits and all of those things. So we all access to all of that information, which we can then share with parents as they need it. But additionally, it hasn't been unusual in the past for us to provide documentation around the child's diagnosis and some education around the immunocompromised state of the child that then parents can take to their employers. And we've done that for lots of different reasons over the course of all of our careers, sure, but now even more so. They do think a really big part of this too goes back to our team being supportive of our families and our families knowing that at any point in time they can reach out to us, have conversation with us, that we will work to provide them with whatever educational materials they might need and any supportive documentation they might need for their various employers. And sometimes it is just listening. We had daily contact with one parent, and I think she just appreciates that someone's listening to her talk about how scary this is.
Thank you for that, Dr. Flanagan. One last topic we'll shift to before we start to wrap things up is sort of the ever-floating question of if, when school comes back. So that kind of being said, a lot of the parents and kiddos have been in the thick of this for weeks now, not being at school, that sort of thing. That all being said, how does one help their children cope with not going to school?
That's an excellent question. So first of all, I would really advise to have, again, open and honest conversations with your child. even though schools officially shut down, I think almost a month or more than a month ago now, that's a long time for a child. So maybe you have conversations that you've had in the past and you repeat those, and maybe different things will come up. Misconceptions might come up, some beliefs. A lot of our kids also maybe weren't going to school, but were having home tutoring, but still that changed and looked different. So there's a lot of shifts, even if your child isn't attending typical school. But what I can say to that is bring in, or at least try, do your best to bring in the familiar to the unfamiliar. So now that they're doing homeschooling, maybe they really enjoyed music time at 11 o'clock every day, and that was their schedule. And if you can add that familiar piece that's into your home life, that can help with the transition of the two. Also, really just validating again their feelings that they miss their friends, they miss kind of how life used to be, and it's okay to be sad about that. You can join in their sadness. It's okay to be angry about that too. It's okay to have these strong emotions. It's what we do with them that matters, and if we're having good behaviors and what we can positively do versus those negative behaviors that we don't want to see from kids. So join in with them in their emotions, and really sometimes they just need that validation from their parent.
That validation, and also, as was mentioned before, keeping that schedule, that's definitely top of mind. The if-when question, I mean, if or when these youngsters go back to school, what sort of outreach is there to help the staff understand the importance of keeping a pediatric patient safe from germs? I'm sure a lot of the districts, if this comes to fruition, will have already precautions in place just to keep the general population of students safe, but kind of that extra step, what can be said for that?
Absolutely. So here, both from the Roswell side of the team and the Oshai side of the team, we all work together and we have a school outreach program. So with the parents' permission or caregivers' permission, we can talk to the school, whether that's the teacher, the staff, the administration. We can meet, whether it's virtually or if we're allowed to meet in person again, have in-person meetings to come up with a plan. And so what we do is really educate the staff so that they understand the seriousness of the topic, that they understand that, the parents aren't just worried parents. They really do have valid concerns about their child being safe in school and safe from germs. So we come up with some education, some action plans of how they're going to keep their child safe, what the school is going to do to keep their child safe. And then maybe those go into their 504 plan or something more formal. But absolutely reach out to us if that is something you would like. We also do meet with the children's class if the patient and parents are okay with that. So we can go in and meet with anything from kindergarten to that 12th grade. We've done it all between all of us on the team. So we really try to aim it at your specific needs, and work together so that we can fight off the germs, keep them safe, but keep them learning.
Well said, very well said. You did touch upon something that I want to kind of just circle back on. You did mention a 504, and now could COVID-19 affect a child's 504 or IEP at this point in time?
So one of the things that we are seeing right now is because there's been a shift, particularly for our kiddos who were receiving home instruction previously, who now are almost trial by fire reintegrated into what is becoming more traditional learning in this incredibly unusual time. We have seen some situations with 504 plans and IEPs just not being able to be fully implemented because of the details that were in them. So one of the things that we again have done is reached out to families that we knew were had children who were going to be at higher risk regarding some of these situations with modifications to 504s and IEPs, and have been in contact with schools while they're closed. So a lot of reaching out to and emailing on behalf of our patients and their families to make sure that children have everything they need. I think one great example that came up 2 weeks ago is a kiddo who had been on home instruction. Now there is no home instruction. All of his global studies homework has been out of the book, and he doesn't have a book because he hasn't been at school. So we were able to work with the teacher in the school district to get a book dropped off to his house so that he can keep up with his classmates. And I think, again, it's important for parents, if there's a concern with a 504 plan or an IEP, to make sure that you're reaching out to the psychosocial team so we can address it quickly for you and really help walk through that process and advocate for you and your child. Very similarly, like Jessica said, as we move back, we'll continue to do our school outreach program, continue to assist with crafting 504 plans and IEPs. It's not uncommon for one of us to be at one of the IEP Committee on Special Education meetings to begin with. So we would plan to continue to advocate for patients the same way that we have before, with just this additional layer of information about this most recent break in education for so many of our kids.
I would just like to add to that, a parent is their child's biggest advocate. So if there are other services, OT, PT, therapy from school that your child is getting, contact the school. A lot of those therapies can still be done via Zoom, and psychologists can still check in and all of those things. And this shouldn't stop that.
Absolutely. Absolutely. And to your point, Dr. Orkika, if they're not getting those services, if the parents are trying their best to advocate and they're still not happening, if the family lets us know, then we will push harder on you to make sure that they're still going on.
We're starting to run close to the end of this wonderful webinar. That kind of being said, I do want to lastly open up the floor to anyone that has any parting thoughts before we close here this afternoon.
I'll just make one mention. I know a lot of times people, they may not necessarily know anybody who has coronavirus, or they're hearing about this. It is something that we are seeing. It's something that we're actually seeing right now. We have had patients with coronavirus. This is very real and can be quite serious. So it really needs to be taken seriously. So a lot of these measures of, do we really need social distancing? It's one thing to say maybe some teenagers want to be rebelling. Sometimes we even feel like rebelling. It can be a little bit difficult to just stay cooped up at home, but this is real. That being said, at least I know in the sickle cell world, from what I'm hearing too, and possibly even for many of our patients, thankfully, this does seem to be less severe for children. So even children who have medical problems seem to be getting less severe illness than adults. So while we're seeing that in the general population, it does seem to be the case even for some of our hematology and oncology patients. That being said, though, we do have cases that it can be severe. There have been deaths reported in children, although extremely rare. It needs to be taken seriously. So this isn't just something that we're saying. This is something that we do need to make sure that we're protecting our patients and protecting each other. So one thing, if we're worried about our 10-year-old getting it, but I worry about the 10-year-old who then gives it to the parent as well too. So it's important that we, as Jessica mentioned, that we're working as a team to protect each other.
Thank you for imparting that on all of us. Anyone else who's on here would like to add anything?
I just want to everybody to just please remember that we are here for all of you. So, you can always get in touch with us 24/7. We are still fully, we are still opening our clinic, as we normally do, 5 days a week during the regular hours. We're always available by phone. So any problems, medical, psychosocial, etc., we're here for you.
I'll just add also, and I know Kate could speak to this too, but there are a lot of resources out there for children and their parents. So if you are looking for more of a physical resource or a guide, there's picture books, there's songs, there's just a lot of things out there that are really good for helping children and adults cope. If that's something you're interested in, again, feel free to reach out to the psychosocial team, and we have been collecting those resources, and we can decipher which ones are best for you and help get them out to you.
Yeah, and I'd add, there's also a lot of medical resources, especially if there's topics we haven't covered. If you go to Roswell Park's website and just Google coronavirus, you'll see that there's a lot of other frequently asked questions and other documents. All of that is updated very regularly with input from the CDC, from the Erie County Department of Health, from New York State Department of Health. Similarly, Kaleida Health also has a lot of resources that have all the updated medical information. And we have multiple meetings a week. We're constantly updating, looking at information so that we can stay as up to date possible on the guidelines. And I would also, like to echo what Dr. Bambach said. We're here for you. We are still taking care of your children. We don't want this to get in the way of them getting excellent care and getting, what's needed to help them cure their cancer or their blood disorder. So, please know that we're here for you. And if there's any concerns that you have, give us a call anytime. We want to make sure that we're here for you all the time.
Thank you so much for that, Dr. Kelly. Couldn't have said it better myself. A big thank you to all of our panelists who have decided to join us today. And thank you to all of the attendees who have stuck it out with us and have listened to all of these experts answer some of these questions for you today. Now, if you didn't have any of your questions that you have burning in your head that weren't answered, we do encourage you to email Megan Crawford. She is at MEGAN .CRAWFORD@roswellpark.org. Again, Megan Crawford. Some of the questions and answers that you heard today, they're also going to be turned into a blog post, which will appear on the Courage of Carly website. And as Dr. Kelly did mention, we are consistently updating our COVID-19 webpage. You can easily access that at roswellpark.org/coronavirus for more on our response. Now, the video from today, it's going to be available to view on demand, and a link is also going to be sent to your email if you register that. So if there's any parents that you know of that didn't have a chance to tune in today, send it along to them, and hopefully they'll be a little bit more informed as well. We do want to thank you all again, and thank you again to all of our panelists for joining us today. Have a great Tuesday, and we'll see you next time. Bye, everyone.